What if your blood pressure medications are silently sabotaging some of your more critical organs? So think your brain, your eyes, your kidneys. Hi, if you're new to my channel, my name is Brian, and I was a practicing physician in women's health for 30 years, and I left in 2017 to become a health coach. Over my last several videos, we've been looking at alternative thinking about high blood pressure management. Is it too aggressive? Is it causing more medical problems? Is it leading to significant side effects that could be detrimental to your health? And this information comes from an article written in July on the Substack platform from a physician who is still practicing, known as a Midwestern doctor. So this person is anonymous. On the Health Without Risk app, we're doing a deep dive into that article and all the information he presents for an alternative viewpoint of high blood pressure. You hear about high blood pressure emergencies, but low blood pressure emergencies may be just as critical. In fact, in the emergency room, a systolic blood pressure of less than 90 is considered a critically low blood pressure. So, what happens if your blood pressure gets too low? Think about organs that suffer a critical decline in function if they don't have enough blood flow. So your brain, your kidneys, your eyes, and your body is set up physiologically to shunt flow where it's needed. And blood pressure medication can interrupt that physiologic mechanism. Reduced blood flow to the brain has been linked to cognitive decline. Your brain needs blood flow to function. Similarly, your kidneys start to struggle if they sense reduction in blood flow, and they try to adapt to that. And if that adaptation is blocked, there's about an 18% risk of acute renal injury with blood pressure medications. In patients with end-stage renal disease, in those with blood pressure less than 130 compared to those with blood pressure of 130 to 139, the lower blood pressure group had an increased risk of dying by 38%. Your optic nerve relies on good blood flow for good eyesight. Vasodilators have been linked to a 71% higher risk of age-related macular degeneration, and beta blockers raise that risk to 72% for exudative AMD. There are four main classes of blood pressure medications, and we've looked at diuretics, calcium channel blockers, and beta blockers. Today we'll look at the ACE inhibitors. ACE stands for angiotensin converting enzyme, so these blood pressure medications block the action of that enzyme. When the kidneys sense a reduction in blood flow and blood pressure, they react by a cascade of events known as the renin-angiotensin-aldosterone system. So renin is released from the kidney, it's a hormone, and eventually creates angiotensin II, which is the most potent vasoconstrictor in your body. ACE inhibitors block that conversion. The most common side effect of an ACE inhibitor is a chronic dry, hacky cough. And I've had that. I took lisinopril for a couple of months, and after coughing every 2 to 3 seconds for those 2 months, I stopped that medication. That is reported in about 4 to 35% of patients taking ACE inhibitors, and a systematic review showed that incidence at 8% overall. Here is that review if you want to look at it. And here are all the side effects of ACE inhibitors they looked at. So, quite a few. And notice the cancer one. We'll talk about that in a minute. ACE inhibitors have been associated with a 19% increased risk of lung cancer. Notice I said associated, doesn't mean it causes lung cancer. But there is a study that recommends that that be looked at in a randomized clinical trial, since it's fairly strong association. And here's that article. if you want to look it up and read it. Their conclusion, meta-analysis of 11 studies show that the use of ACE inhibitors is a relevant factor for lung carcinogenesis, and the ACE inhibitors carry a greater risk than the use of angiotensin receptor blockers, which is in sort of the same class on the same cascade of hormones leading to angiotensin 2. So more randomized clinical trials are needed. On November 16th, 2024, I did the first of a series looking at a Midwestern doctor's article on high blood pressure. You can see that free. You can join free for 10 days at the Health Without Risk app. In order to create an account, you have to do that on a computer or laptop, after which you can download the app and sign into it on either an Android or an iPhone through the App Store. So join me if you want to do the deep dive into this article, and we'll continue on this series. Have a great day. I'll talk to you later. Bye.